Hi my beauties, welcome back to Younger. Today I'm going to be talking about skin cancer and in particular melanoma. So the reason why I wanted to talk about this, as much as I love cosmetic dermatology and aesthetics, and usually my videos are on lasers and injectables and aesthetics, as a dermatologist and a Mohs surgeon I have due diligence that I want to attend to, and I want to address melanoma because it is a problem and it is a potentially fatal skin cancer and one that deserves a definite video dedicated to. So before I move on, I ask that you like, comment, and subscribe and share this video with someone who may find it useful. So there's three main forms of skin cancer: squamous cell carcinoma, basal cell carcinoma, and melanoma. So I'm going to be talking about melanoma today because it has a high fatality rate. It can be potentially fatal, and it happens among younger individuals. So teens, 20s, 30s, 40s. It happens in older individuals too, but there's many different types of melanomas. And the most important topic I want to talk to you about today is what to look for and when to worry and when to be concerned and when to go see a dermatologist. So I don't want to freak everyone out if you see a new brown spot or if you're looking at all the moles on your body. I don't want you to think that you have a melanoma, but I also want to teach you and educate you on the signs to look for when it warrants a biopsy or when it's kind of like a red flag that will indicate you to go see your dermatologist. Now, again, before I move on, because this is a little bit more serious of a topic, and as a dermatologist and medically legally, I want to tell you to always go and have evaluation by your dermatologist or by your primary care doctor. And by no means is this a dermatology consult, or I just always want you to be sure to back up anything that you find on your own self-assessment or skin exam, and not just go based on this video. This video is just to kind of enhance your education and knowledge, but not to diagnose or treat or give advice on how to handle a certain brown spot or freckle or mole or birthmark if you happen to see one on yourself. So always consult with your physician before moving on or deciding to seek treatment or evaluation. Always have a doctor evaluate. I can't say that enough. So anyway, moving on, when you look at brown spots or if you have a new mole or a changing mole, it's always a good idea to see your dermatologist. Now, we always talk about the ABCDEs of melanoma. A stands for asymmetry. So any mole that's kind of asymmetric, if one half doesn't look like the other half, usually if one has a jagged border and one has a smooth border, things like that. Or if it's asymmetric in the color, one half is darker than the other, it's always kind of a red flag to go have it evaluated if you have any asymmetry in any existing birthmark or mole. B stands for border irregularity. If you have kind of an ill-defined border, it's not a nice smooth linear border or a nice smooth round border, that's a little bit more concerning. If you have a tail kind of growing off of one area of the mole that looks like it's an outreaching hand, or it's kind of looking funky in the border, that's always a red flag as well, and you should seek evaluation by a dermatologist or your primary care doctor. C is color variation. So any areas of a mole that look brown, blue, black, red, whitish, there's an area where there's retraction or the mole has gone from being a darker color to having kind of like a lighter spot in it, that usually means that the mole cells are diving deeper, and that's a little bit more concerning. So it's always good to have evaluation if you have any color variation. And D is diameter. Anything bigger than 6 millimeters, which is the circumference of like a pencil eraser, always usually warrants a biopsy or evaluation by your primary care provider. So there's sometimes we say ABCDEs, and E is evolution. If a mole is changing, it's bleeding, it's itching, it's more raised, it's less raised, it has a evolution of different color variation or different size, it's always a good idea to have it evaluated. So in dermatology residency, and according to the American Board of Dermatology, you're allowed to have new moles up to the age of 30. After 30, if you start getting new brown spots or new moles, it's always a good idea to have it evaluated. So that's not to concern people if you notice a new freckle. Like I just noticed a new freckle on my finger the other day, and it's getting a little bigger, so I'm actually going to probably biopsy myself Friday this week in clinic when I go back to work, and I just want to evaluate it just to do my due diligence and have a dermatopathologist look under the microscope and make sure that everything looks looks fine. So again, not to concern you, and I don't want you to go home and worry about every little thing on your body, but it's good to kind of know your skin, give yourself skin exams. Ideally, it would be once a month, but at least maybe twice a year, every 6 months. When you're in the shower, use mirrors, kind of know your skin, where your moles are, and if you notice anything changing, go see your doctor or your dermatologist for a biopsy. Usually what we do is we just numb you up with a little local anesthetic, and we take a sample of the skin and we send it to the pathologist. What the dermatopathologist does is they look under the microscope and they evaluate it to see if there's any atypical cells. Sometimes it comes back benign, then we just watch and wait. If it's kind of in the middle, moderately atypical, mildly atypical, severely atypical, we'll excise it out and take the margins and make sure that there's nothing else going on. And if it's severely atypical or it's a melanoma, then you basically seek further treatment depending on the severity of the different histologic findings or clinical findings. It just determines the type of treatment that you have to go under. But the key is to jump on it fast, because these can be potentially fatal malignancies, and so you always want to address them. Don't wait on it, and basically undergo treatment if needed. And the most important thing is surveillance. Like I said, look at your skin, have your partner look at your skin, and just make sure that you don't have any new or changing lesions. So basal cell and squamous cell carcinoma are also skin cancers, but they're less aggressive. They're more indolent, meaning they take a long time to become locally invasive. Sometimes squamous cell carcinoma can metastasize too, but much less than melanoma. Melanomas can go fast, and I remember in dermatology residency, one of our jobs were, when we were on consults or on call, was to evaluate when people would come in and say they would have a headache, and they'd get an MRI and they'd see metastatic melanoma in their brain. We would have to do a clinical skin exam to see if we could find a melanoma, and sometimes it's so fast that it would spread and it would metastasize already. So again, not to scare you, but it's not something that you mess around with. It's not something that you want to just wait and not attend to. But on the other side, the flip side, normal freckles, birthmarks, sunspots, things like that, which are usually just benign and more just pigmentation in the epidermis, the upper layer of the skin from excess sun exposure, brown spots, freckles, things like that, are not as worrisome. But it's always good to have yearly skin exams with your dermatologist so they can kind of look you over. Sometimes dermatologists also do mole mapping, where they take pictures of you and they kind of monitor using clinical photos to see if anything's changed. And if something has been changing, then they usually biopsy it, and the treatment depends on what that biopsy shows. But it's always good, again, to see a dermatologist at least once a year, sometimes every 6 months. And anytime you have any new or changing lesions, or new or changing brown spots, birthmarks, anything that you notice that wasn't there before, it's always good to have evaluated by your dermatologist, ideally, or your primary care doctor who can refer you to a dermatologist for a further evaluation. So I hope this helps you guys, not to concern you, but ABCDEs of melanoma, look out for them. Don't wait on it. If you see any new or changing brown spots or skin freckles or birthmarks, have it evaluated. Hope this helps.